Hi, my name is Riyadh Ahmed. I'll be presenting 4.2 Build Pre-Launch to Launch with my group members Jihwa, Changhyun, Antony, and Humayun. 4.2.1 Evidence Generation has to involve data collection and analysis that supports clinical and economic value of the medical device compared to alternative treatments, according to the outcomes that are relevant to customers today. A wide selection of study designs can be utilized to support such evidence generation as shown in Figure 4.4. The array of studies depends on the medical device type and on the clinical needs that are unmet. As shown in this figure, product value includes efficacy and safety, comparative effectiveness, patient outcomes, long-term outcomes, product features, cost of illness, cost effectiveness, and budget impact. Continuing on 4.2.1 Evidence Generation, it is crucial to understand the challenges with developing an evidence base for a device that uses RCTs. The studies done are not able to provide data against the full scope of the competitors, while given the rapid development time of the devices. For example, many devices tend to go through modifications which can affect the performance of the device and the safety, therefore making it challenging to perform RCTs on all device iterations. Furthermore, the competitors for a specific device will change, making it very difficult to compare all relevant alternatives within one RCT. In order to address these challenges in data development, other approaches such as observational studies are used. 4.2.1 Efficacy and Safety. In the US, the pre-market application requirement for devices is a new or modified device must be safe and efficacious and shown in preclinical and clinical data. Observational data, for example, registries or chart reviews, are used to supplement the efficacy and safety data through adding longer-term follow-up and in more greater patient populations. 4.2.1 Comparative Effectiveness Research. CER is a comparison of treatment alternatives. Even though research is not a requirement of regulatory approval, it has become an expectation, while some cases a requirement in hospitals and physicians. Within a setting of budget restrictions and high competition, research is important for product success. Systematic reviews, analysis of hospital records, ITCs are study designs used to convey the comparative effectiveness of devices. 4.2.1 Patient Outcomes. Patient outcomes involve endpoints relevant to patients that are reported by the patients. Patient outcomes include a patient's preferences, autonomy, needs, function, and disability. Studies that cover patient outcomes may sometimes incorporate a variety of settings and population types to address the individual differences. The patient outcomes data, for example, PRO endpoints, are collected in a clinical trial for an extension study. Such data can help determine if improvements in trial-based clinical endpoints translate into an impact on outcomes that are significant to the patient.
Hello, my name is Mohammed Humayun Hussain, and I'll be continuing the 4.2.1 segment, long-term clinical outcomes. Before market approval, long-term data on product efficacy and safety is considered an integral factor in optimizing and regulating product value. It establishes readiness and absence of said medical product, as well as provide maintenance of the product efficacy, durability, and operability refinement. Long-term trials are done through modeling, prediction, prospective, trial-based, or observational studies. An example, myeloma kidney product, it has substantial increase in recovery, 63% from the new device and 17% by conventional care. Next slide. Product features. It is created to note the advantages of attributes without any clinical endpoints of the medical product. Differentiation of product is noted when exhibiting or demonstrating. Differentiation can be based on attributes or features such as options that offer user ease of operability, ergonomics, advanced technical descriptions, range of products with selections, exclusive features, etc. Thus, differentiation of item specification or attributes is suitable for a value argument of a medical product. Next slide. Cost of illness. It states healthcare costs and resources invested related to management and disease. There are a multitude of examples associated with cost of said product, and such analysis is required to make. Let's take an example of a medical product called artificial hip. We have to consider its expense for surgery, care after surgery, long-term care, surgical issues, device complications, etc. These data aid in quantifying the size of the disease burden that needs to be considered. Typically, type of studies usually used are database analysis and chart reviews. Next slide. Cost effectiveness. It's a process of evaluating medical product to be priced suitably or appropriately. Cost effective analysis is used in various ways for this process. It notes the clinical value of the item, compares with other product with effectiveness, simulate long-term advantages by mathematically prolonging the clinical trial's result, and finally quantifying the value of the product by illustrating the gained benefits relative to the cost compared to the competitor. The cost-effective analysis can be informative in strategic pricing and defines threshold for safety, cost, and efficacy. Therefore, product development decisions are made, such as if the product doesn't provide sufficient value to the customers, then the reallocation of resources will be terminated by the company. Next slide. Budget impact. Most customers seek affordability of said products. Budget impact analysis is utmost required information that serves to state said product value by highlighting the cost that can be avoided and customize the budget according to the customer. Example of highlight costs to avoid are hospital-related expenses, infection attained from hospital, duration of stay or readmission of patients, etc. Example of customization of budgets are a competitive product used, population size, or expenses of treating adverse events. Demonstrating cost of offsets related to avoidance of clinical events with devices that have comparable acquisition cost is recommended.
Hi sir, my name is Changhyun Nam and I'm introducing the project of book presentation 4.2.2, the pricing and the reimbursement strategies. The strategic pricing is they choose the correct price between the companies and the customer. Both of them are satisfied. And companies should do the requirement of return on investment as well, because it's very important for the return policy to the customer as well. And the most important thing is the bench marketing and also research the market, which product the hospital need in biomedical field, for example. And there's also step that I put it on the screen that as you can see. But again, the most important thing is market, research the market. So how the customer, what customer need from the company and how they satisfy with the products. And the second thing is strategic coverage and reimbursement processes, because this is also important that the company should provide the proof that how their products are relative with the customer, how they need. And they're also important for the codes that procedure may not cover fully, or for explanation about the new devices cost as well. Thank you for listening to my presentation.
Hello, this is Antony Syde, and I will be covering the 4.2.3 product value propositions. So a product value proposition is a set of value messages primarily based on evidence, and it includes all aspects of product value relevant to key stakeholders, including physicians, patients, payers, purchasers, reimbursement panels, and HTA groups. It plays a central role in all phases of product support by guiding evidence development, ensuring consistency of messaging across regions between health, economics, and commercial teams, providing messaging that is tailored for market access audiences, and it answers key market questions regarding a product's clinical and economic values. So it is important to distinguish between the marketing plan and the product value proposition. Although they will have product and brand messaging that overlaps, the product value proposition emphasizes evidence-based value, quantitative measures, and includes sections specific to non-traditional audiences such as payers, purchasers, and HTA groups. So overall, it's more of a data-heavy approach to the product value. And this figure provides an example of this. So, for example, we can look at number 4, economic value of the product. Some examples would be that the price reflects value, it has a low budget impact, and cost savings of the product. You could also examine the cost effectiveness versus other alternatives of the product, how hospital resources can help with efficiencies, and you can also look at the economic data across different regions to compare and contrast.
My name is Jihwa Lim. I will be presenting on marketing and communication tools. So after medical devices develop, it becomes a core tool for internal and external communication for the build phase. Communication tools for internal and external can be divided into 6 different types as shown in the diagram. So traditional sales and marketing tools include items such as product brochures and training packages. Abstracts and publications are written in a way to target specific audiences. Internal Global Value Dossier is a document that describes key value of a given product. External Payer Value Dossier is a document tailored for payers and purchasers. BIACE and Cost Effectiveness Model is a tool that is customized for internal communications for discussion. Interactive model describes information such as budgets and hospital efficiencies for field-based teams to demonstrate the product to customers. Moving on to timing of the activities. At this stage of build stage, timing is determined by planned launch sequence and support from local markets. Approximately 18 to 24 months prior to the launch, major markets should be informed about the product, including but not limited to expected value proposition, evidence generation activities, market access, and pricing strategies. This information should be updated for every 6 months or whenever a major revision occurs. Approximately 6 to 12 months prior to the launch, finalize information of the market access strategies, supplemental produce evidence, device value proposition, communication tools, and more should be provided to the lead countries. It is expected that these materials will undergo continuous updates during and after the launch marketing periods. Thank you.